Did you know that it takes an average of 17 years for only 14% of research findings to make their way into routine clinical care? Hi, thanks for joining me for this new series called Implementation Science 101, where I try to demystify implementation science. I'm Dr. Ruben Martinez, an implementation scientist and assistant professor at Brown University. I'm passionate about all things implementation science, and I'm excited to walk you through how we bring evidence-based care into real-world settings. Now, back to those 17 years. There are so many effective treatments for conditions like cancer, depression, and high blood pressure that never reach the people who need them. Sometimes that's because researchers don't consider how those treatments will work in real-world clinics. Other times, these interventions fall flat because of factors related to the context where they're being implemented or put into place. No matter the case, it's important to know that even the most effective treatments can fail if we don't consider the real-world environment, like clinic staffing, patient preferences, and insurance coverage. This challenge sparked the growth of implementation science, which studies how to bridge the gap between what is known to be effective and what actually happens in everyday practice. Implementation science uses methods from a lot of other areas of research and science, like user-centered design, qualitative research, and quality improvement to help effective treatments reach everyday settings. For example, let's say a primary care clinic wants to start screening kids for mental health problems. An implementation study might involve the clinic staff, patients, and parents co-designing a workflow that fits their routine, like integrating screening into check-ins or follow-up calls. I promise we'll get into more specific implementation studies later on in the series. But first, it's time for our fun fact. Even though the term implementation science didn't appear in a journal article until the mid-2000s, its roots trace back to the early 1900s. You should also know that even though I used the term treatment earlier, implementation science isn't limited to treatments. These methods can be used to increase the use of policies, teaching methods, and so many other innovations. That's it for our first episode of Implementation Science 101. In the next episode, we'll be diving into how implementation science stands apart from clinical science. A quick shout out to our sponsors, Advance RI CTR and the Bridge program at Brown University. Don't forget to like and subscribe if you found this video helpful. And if you have any questions for me, put them in the comments and I'll answer them as soon as I can. Until then, keep bridging the gap.